Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Uganda is among the world's top 3 refugee hosting nations, possibly the first in Africa, but refugee communities continue to be disadvantaged on many fronts with poor socioeconomic and health outcomes. As COVID-19 ravages the world, refugees are not spared either, which is one of the reasons Dr. Gloria Seruwagi and her team carried out a study on this particular group of people.
It kind of struck us that the guidelines which the general population is struggling to abide with might have the same effect in refugee settings. And yet with them, we already know that they are constrained. Even before COVID came in, the settings are usually crowded. They have very many people, up to 6 people, even 10 in some households, in a one-roomed house. So when you think about it, you have guidelines like physical distancing, you have guidelines like washing hands in order to prevent COVID-19. But the longer-term contribution we wanted to make was to support the national response to COVID-19 and increase compliance, at least starting with those disadvantaged, marginalized sometimes, and vulnerable communities.
1,500 participants evenly distributed across the 3 study sites in Central, West Nile and Southwestern refugee settlements participated in the research with a fairly even distribution across nationalities. Despite being more knowledgeable with regard to symptoms, causes, risk factors and treatment of COVID-19, men have poor compliance with COVID-19 preventive measures compared to women.
I don't think it applies only to COVID-19. Generally, in terms of health-seeking behavior, women have always been more compliant, and they will tend to seek care, and they will tend to be very cautious.
Some cultural factors were also responsible for the nature of response and adherence to the guidelines.
For example, as you might know, the Muslim community, some of them raised the issue of the alcohol content in the sanitizers, and so they say, well, this is not compatible with our values, so we don't use it that much. Communities like the Somali community and among the women, because as you know, their dress code, they do cover up the face. So they were complying in that sense that they're already covered by virtue of their social cultural norms and values and dress code. There's compliance fatigue. And it's not just among the refugee population, it's also among humanitarian aid workers, it's among health workers at the health facilities. It's generally everywhere. Even the leaders were not wearing masks for the majority of them. And this had an effect also on the behavior of the refugee community, because their reasoning is that if the enforcers and the leaders and the service providers are not complying, then why should we? We found also myth around suspicions that some people are using it as a scheme to get money. Then there's this survivor mentality where people think, I've gone through so much, COVID is nothing, and then COVID will not kill everybody, I might be one of the few survivors. So there is that casual approach to this deadly disease.
The researchers also observed that there are also stories of resilience, innovation and improvisation among refugee communities.
Most of these people, their first language is not English, and yet most of the guidelines, most of the messages, communication messages around prevention were in English or Luganda or the local language of the host population, not their nationalities. So the local leaders had translated some of these messages in their communities, and so the awareness was quite high. The only challenge was that children were not targeted in particular. So we found high levels of awareness among adults, but then we found very low awareness levels among the children.
The team highlighted the need for innovation and designing age-appropriate messages and interventions for children.
And we need to focus a lot more on risk behavior reduction, because the focus of most communication that has been going out until this point has been to spread awareness. Now people are aware the average population is aware. So can we now shift focus of communication interventions and any other interventions in this area to make sure that they are focusing on behavioral change?
These preliminary findings are part of an ongoing 6-month study. Data from the study also shows that over 151 refugees countrywide have contracted COVID-19 and 3 deaths have been registered. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.